Hello, my name is Christina Campbell. As German philosopher Friedrich Nietzsche once said, "Without music, life would be a mistake." Music has always been an integral part of humanity. Whether this is in ceremonial, educational, or even private settings, music tends to be ever present. So, naturally, a tie-in with exercise and sports seems like an obvious idea. There have been many studies done to see just what benefits music can offer physical activities. There are many potential benefits in the addition of music to physical activity. Notably, listening to music before or during the activity can promote more positive mental states, better physical performance, lower signs of perceived exertion, and even improve oxygen consumption. Music can change the way we view exercise and physical activity, even at varying intensity levels, by creating more positive connections. Oftentimes, people feel like they get better quality work done when they incorporate music into their physical activities. This is important as most people tend to have more hedonic views looking to do more pleasurable activities rather than those that may bring pain. This change in viewpoint makes it more likely for them to continue pursuing such activities in the future. It has been found that music can act as a stimulant or even a way to promote relaxation, sort of like a way to help athletes to create the mindset that they want for their upcoming activities. For example, they could listen to songs like Eye of the Tiger or We Are the Champions to get hyped up, or maybe slower classical music to help relax and clear their minds. Music can and often is used at sporting events to help create a certain atmosphere and help bring in audience involvement. It is common for wrestlers and MMA fighters to enter arenas to pre-selected songs to intimidate their opponents. Additionally, the speed of the music can affect not only a person's mood, but also their physical reactions. Fast music, about 120 beats per minute or more, tends to activate the central nervous system, resulting in increased heart rate, blood pressure, raised body temperature, and muscle tension. This is likely because 120 beats per minute is twice the resting heart rate of healthy adults, and has been found to not only be the preferred walking step frequency, but seems to reflect a sort of natural rhythm. On the other hand, slower, softer music tends to decrease sympathetic arousal and create opposite effects. Bodily functions like heart rate and respiration rate often gravitate towards synchronization. Because of this, people tend to prefer faster tempo when doing physical activities. Taking a closer look at how music affects the brain may explain more of the psychophysiological aspects, for instance, perceived exertion. An electroencephalograph, or EEG, has shown that music can reduce theta waves in the brain, specifically in regions that are connected to fatigue symptoms. Music has been found to act as a sort of suppressant. Perhaps this is caused by the music taking over signals in the brain, creating a distraction from the actual physical activity happening. This effect is more prominent in low to moderate activity intensities than higher intensities due to the increase in physical discomfort. However, elite performers have shown benefits of music on perceived exertion even at high-intensity activities. There are also beneficial effects of music on cardiovascular and respiratory functions. In fact, listening to music that a person enjoys can actually increase blood flow efficiency by 26%. Therefore, the efficiency of blood flow would have positive effect on oxygen utilization improvement. When there are more rhythmically synchronized movements during exercise, it could promote more regulated movements and slightly reduce workload energy costs, which in turn could improve physical performance. This is especially important for repetitive and rhythmical long-duration activities like running and cycling. The effect that music has on the cardiorespiratory system could be a possible explanation for the small effect that music has on heart rate. There are significant differences in the effects that music has on the exercise domain and the sports domain. For instance, due to the amount of control one has, exercisers tend to have better performance effects due to music. Also, when exercisers or athletes sense the rhythm through the movements of those around them, creating a sense of unity and affinity, has shown some credence to the motivational properties of music. This creates an atmosphere of enjoyment and could even help alleviate potential feelings of embarrassment. Music and physical activity can be beneficial when it comes to improving health and cognitive functions in the elderly. Because physical activity increases oxygen levels in the brain, it actually helps to improve some brain functions and structures. All of these contribute to neuroplasticity in the adult brain, improving cognitive performance, reducing risks for decline, dementia, and rates of depression. Music has been found to enhance the rhythmical auditory perception, or the ability to understand and synchronize movements to the beat. There's also been evidence that music has been shown to help reduce depression, anxiety, and cognitive delays in elderly patients. Activities incorporating music and movement, especially with an emphasis on rhythm, can have similar positive effects on brain functioning as cognitive training does. It is actually more effective at improving language and alleviating symptoms of depression and anxiety. Since music acts as a way to distract from perceived exertion and raises more positive feelings in people, it is likely that it could also act as a distraction from negative thoughts and feelings. Another avenue that shows promise when it pertains to the effects of music, physical activity in the brain, is online physical exercise programs. More specifically, the connection to improving working memory in older adults. Due to the COVID-19 pandemic, there was a significant rise in inactivity in adults. Finding an alternative in-home system to promote physical and mental health could benefit all in the future. There is evidence that online physical exercise with music helps to improve working memory. However, there are some drawbacks to online exercise, as there are higher rates of dropouts, as well as a lack of community environment and resources. Accessibility to the internet has improved since the pandemic, but that could pose an issue, as older generations have a harder time with understanding how to use newer technology.